the deletion of the term fits, but they said the seizures, which were confirmed by video monitoring, occurred when people brushed the sides of their mouths and caused their faces to jerk and twitch. One patient salivated vigorously, while another couldn't let go of the toothbrush during the seizure. So many words. Notice the focus that was actually directed towards the symptoms. Again, we're looking at traditional leading to fear and stigma as a result of helplessness of the bystanders. Well, technology information sharing processes do allow media headlines and text to be seized as worthy of attention for readers. D'Souza, the author of this study, said the rhythmic act of brushing teeth may excite an already overly excitable area of the brain. What is he thinking of? It's medically accurate, but the explicit nature of the description, plus the language used and aligned with perceptions that reinforce the surrounding loss of control, then really does equal the implications for understanding and the acceptance for the individual. How many teachers are going to be willing to take away children with epilepsy on school camps and ask them to brush their teeth? Maybe I'm just jumping to another conclusion, but the potential is there. The negative language used, the study reflects a minority of the population and a minority of those with epilepsy. Through the voice of the media, though, the meanings and the links become generalised and, in fact, do establish a context of fear. Other things, other little quotes that we have in the media headlines. The parents of a toddler who suffers up to 150 fits a day have spoken of their anguish. Epileptic baby Harry suffers seizures, causing violent limb jerking, and Harry to cry and scream hysterically. Very strong and emotive language. The thousands of young children who suffer from these catastrophic epilepsy seizures. What messages do we take on? In fact, very recently here in the US Chief Justice John G. Roberts faces a complex diagnosis and a difficult decision regarding medication. He had actually had his second seizure in 14 years. And so now he meets the criterion for being diagnosed with epilepsy. The media reports talked about weighing the risk of more seizures against the risk of side effects from the drugs. They talked, all these wonderful neurologists, who all, I'm sure, mean well, but talk about the frightening and traumatic experience for patients and family members. They talk about avoiding heights, not swimming alone. Many states bar these people from driving until they can provide evidence that the disease is under control. Again, what is the hidden meaning? Further, drugs can have troubling side effects. If you're on medication, just as Fred was talking about this morning, the poison, in fact, of the drugs becomes the poison of attitude and perception. And look at the things. Drowsiness, insomnia. Well, it's either you're awake or asleep. Weight loss or weight gain, or again, rashes, irritability, mental slowing, and forgetfulness. The interesting word, should or shouldn't. Even if Roberts has epilepsy, it shouldn't affect his work. Oh, it's a nasty word, isn't it? In fact, one of the blogs that's responded to by Dr. Oren Davinsky, who is the director of Epilepsy Centre at New York University, one of the people wrote in and said, do concerns exist that the medication that Chief Justice Roberts may need to take could influence his performance in the bench. Oh, so now we're going to actually put a question mark above his ability to function as a human being, his alertness during arguments, his ability to deliver on his responsibilities. Again, we've got back to the question, are epileptics more likely to display certain personality traits such as irritability or empathy? And his response is there. Although some epileptic drugs can affect cognitive function, it is likely, very likely, that Justice Roberts could be well controlled on a low to medium dose of a well-tolerated anti-epileptic drug. Thus, he should be able to function extremely well. Again, we could look at that in a very different way. People with epilepsy have higher rates of behavioural problems, such as depression and anxiety. Again, the message. Well, in conclusion, these children, these people with epilepsy, they do have two stresses. They have a chronic condition which is often associated with personal, social or economic disadvantage. So often we hear of people with epilepsy not being employed, of losing their jobs, of epilepsy associations needing to be active in search for work for these people. And of course the other stress just by the epilepsy in all its facets. The media is currently reinforcing these negative images through the commitment to focusing on attention value of headlines and text. We do need to look at the power of the media in their role for information and knowledge. Extensive coverage, in fact, demonstrates how information concerning a minority becomes generalised in its context, and in fact there is a potential to reflect society's inability to discern fact from sensationalised narrative. As a teacher-educator, we're concerned, all of us are concerned with our children. All of us are concerned with supporting teachers in their dealings with our children. For me, it's an important feature for the successful socialisation of students with epilepsy that they are accepted by their teachers. We know through studies that the attitude and the perceptions of teachers have a great and direct influence, and they also have the power to and the potential to correct negative misconceptions and prejudices. Bless you. Teacher education programs, in fact, what we are looking at very much is developing an awareness and a deconstruction of the media image to move towards positive inclusion of students in